A UFT study suggests people likely aren't protected from the COVID-19 variants that are dominant right now, namely BA4, BA5, even if they've been vaccinated or recovered from an infection. Researchers looked at antibody levels in blood samples from 63 patients. They found neutralizing antibodies last 3 to 4 months before dropping by 70%. They also found vaccination and prior infection did not protect against Omicron or its subvariants. Scientists say the test they developed to measure immunity in participants could become a valuable tool for deciding who needs a booster shot in the future.
And CB24 Chanel Call joins us live with more on this story.
Hi, Chanel.
Hi, Bakari and Jen. Good afternoon to both of you. This new antibody test from the University of Toronto now offering a more clear picture of our body's immunity, especially when it comes to its immunity against the Omicron variant, some of the more new subvariants of the COVID-19 virus. For more on this, I want to bring in Sean Owen, Associate Professor of Pharmaceutics and Pharmaceutical Chemistry at the University of Utah. Thanks so much for making time.
Yeah, thanks for having me.
I want to start with your response to this new research. Did anything in this new research, any of these findings surprise you?
No, so this work was a collaborative effort between the University of Utah and the University of Toronto. So we co-developed this assay. I think what was most surprising was not that the vaccine stopped working, but that it was no protection against later variants.
And what about the blood test? What's your sense of how accurate this blood test is in really determining someone's immunity against Omicron and some of the new subvariants that we're talking about, especially BA5?
Yeah, so what we did specifically with this assay was to make a new version of the assay for each one of the variants. And we did that so that we can make sure and be really specific with each of the tests. I think that it's really accurate. We've been able to look at probably 95% accuracy with the patients we've tested. I think it's a pretty good descriptor.
Sorry, I think it cut out there for a second. I do want to ask about how this blood test was developed. You look specifically at patients who were hospitalized with COVID-19, so obviously the more severe cases.
Yeah, we looked at a range of patients, both those that were hospitalized and patients that were just vaccinated, so we could compare and see if there was a difference between vaccinated patients or patients that got natural infection. And we didn't really see a big difference between those two different types of patients in terms of protection.
What does that say? That sounds surprising to me that you're not seeing a difference in terms of protection.
Well, I think that what it says is if you had a natural infection or if you've been vaccinated, then you're likely protected against the variant that you had. But what it also says is that it doesn't give you protection either way for later strains, especially the Omicron variant. The other thing I think it tells us is you can get protection from being infected, but you're going to get sick in order to do that. So a vaccine is probably a better choice to avoid that and still have the same protection.
Okay, and I do want to mention, we're in the middle of summer. It's busy. Lots of people are very social. Lots of people are traveling as well. How should this new research help inform our behavior?
Yeah, I mean, my personal opinion is that in crowded areas, especially with low ventilation, that we should be really vigilant about still masking and still protecting ourselves. And maybe if it's not for you, maybe it's for somebody else. I think that we still need to be a little bit cautious. People might not get super sick from these variants, but they are spreading and there's a chance for more mutation. So be careful, especially in crowded areas and on public transportation.
And given these findings, Sean, would you like to see fourth doses offered more broadly?
I think a better option instead of a fourth dose is a different vaccine. It's pretty evident that boosters really help protect against serious infection. But if we're going to get to a point where we're stopping the spread to any degree, I think we need to redesign the vaccines to be more specific. And I know that several of the vaccine companies, both here in Canada and also in the United States, are developing specific versions for Omicron, for Delta, to try and be better protected.
Sean Owen, a very interesting conversation. We so appreciate your time and your insight on this. Thanks so much.
Thank you for having me.
All right, Bakari, Jen, it's back to you.
Yeah, very timely, Chanel. Amid calls to open additional boosters to more people. CP24 Chanel Call.